It is now time to talk with Dr. Jennifer Casey at Dedicated Senior Medical Center about their center and how they are helping seniors this winter. Dr. Casey, thank you so much for joining us this morning.
Thank you, Maddie. Happy to be here.
Dr. Casey, could you begin with explaining what Dedicated Senior Medical Center is and tell us how you guys are impacting the community?
Yeah, Dedicated is so excited to be in the Detroit area. We have 6 offices located in and around Detroit, and we cater to specifically the senior population. We look to take care of those that are 65 and older. We like to say that we honor seniors. We treat them like members of their family. We bring our seniors back to see their doctor at least once a month, because we know with what we call a high touch model, where we bring patients back frequently, we're better able to know our patients. We form that really strong doctor-patient relationship and build trust with our patients, and the patients build trust with their doctor. And we really, like I say, we treat our seniors like they're members of our family. We fully believe at Dedicated that seniors are the most special population and they deserve all of our time and attention. We look to keep seniors out of the hospital by bringing them into our office first, so that we can take care of things early on and keep them healthy, happy, and at home.
The ongoing COVID-19 pandemic has affected the entire community, as you have seen, Dr. Casey, especially the seniors. How have you seen the impact on your patients there at Dedicated Senior Medical Center?
Yeah, unfortunately, we're still dealing with this nasty COVID pandemic, and as we all know from listening in the last couple of years, that this particular virus can hit and injure and cause more problems for seniors than other patients of other ages. So it's important to us that we are proactive in protecting our seniors. We have vaccinations in all of our clinics. We're able to test patients for COVID in all of our clinics, and we're able to connect people to treatment, whether it's medications or some of the IV treatments for people that have COVID.
And Dr. Casey, at Dedicated Senior Medical Center, you guys have a lot of services and programs that you can provide for your senior residents and patients there. Can you tell us a little bit about some of the programs and services that you guys provide?
Yeah, so we like to keep everything under one roof if we can. So in addition to offering primary care for our patients, outpatient primary care for treatment of diseases like hypertension and diabetes and high cholesterol and such, we're able to do several things within our offices as well. Again, we like to keep our seniors healthy, happy, and at home, and keep them from having to run to other specialists or the hospital or the emergency room. We're able to do x-rays in all of our centers. So if there's any concern for like a pneumonia or a broken bone or anything, we can do that right in our centers. We're able to give a variety of medications in our centers, as well as IV fluids. So if someone's not feeling the greatest and they come to our center first, we may be able to treat something before they'd have to go to the emergency room. We have the ability to do the ultrasound in all of our centers, and every patient that we take care of gets an echocardiogram or an ultrasound of their heart. That's just one of the things that we do for all of our patients, so that we're able to check for higher risk diseases that people may not know about. Patients may not know that they have a problem with the valve in their heart or that they have a blockage in their vessel. And if we're able to catch that, then we're able to work with the patient to treat that, to keep somebody from having a heart attack or a stroke. So we find that it's very important that we do a lot of screenings for our patients as well. So similar to that echocardiogram, we're able to screen for our patients for problems with their nerves in their feet and hands, or what we call neuropathy. We do screenings for dementia, screening for breathing problems. Every patient also gets an EKG that looks at the electrical activity of the heart. All of our physicians as well do a variety of small procedures in the office. So whether it's a biopsy of a skin or removing a skin lesion, we do a lot of joint injections for pain that seniors may have, particularly in the shoulders and the knees. So it's nice that we're able to be a one-stop shop for our senior citizens.
Dr. Casey, at Dedicated Senior Medical Center, for your patients that you help there, have you seen anything, a service or a program that you guys provide there that has been, more frequent during the ongoing pandemic, or something that in the past year or so that your patients have been coming to you more and more often for?
Yeah, that's a great question. I think that the biggest thing with the pandemic is that everything's a little different for all. We like to bring our patients into our office, but we do have the ability to do telehealth or virtual visits. And in addition, we're able to help seniors with the resources to do that. So if someone doesn't have a Wi-Fi capable device in their home, or unable to do that, we're able to provide tablets to our patients so that they can stay connected with us. We provide transportation for our patients to get to and from our centers and to and from other appointments that they may need. That's an important piece. We know a lot of people sometimes will miss doctor's appointments or can't get to the doctor. We want to make sure that we're taking down any of those barriers that we can for our patients to bring them in. Certainly the pandemic has everybody frightened, especially frightened to come into some healthcare facilities. We call it ludicrous safety. We are very specific about how we screen all of our patients and anyone coming into our centers. Like I said, we're able to test patients and connect them to treatment if they do have COVID. But our centers are big and bright and open. We have set rooms for people that may have an infectious disease that we can clean and keep people safe that way. We're able to, like I say, connect people to testing. We're able to assist patients with masks. We're able to assist patients with pulse oximeters to check their blood oxygen levels should they become sick. And really, I think the biggest thing that sets us apart is that patients are connected to their doctor. Patients have their doctor's personal cell phone numbers. They can call their doctor any time of day, 24/7, if they have a question. So really, that right there, I think, sets us apart and puts us better able to take care of our patients here in Detroit.
And Dr. Casey, at Dedicated Senior Medical Center, you guys also host a variety of community and educational events. Can you tell us a little bit about those and what those provide to your patients?
Yeah, so we do a variety of events, from bingo to crafts that we do in our centers. All of our centers have a community room that can be used for a whole variety of things. We like our seniors to come into the center and feel like it's a home, like it's a community center, not just a doctor's office. One of the really fun things we do are what we call doc talks, and that's where we have our primary care physicians either out in the community or in the centers talking to seniors about their health. It may be about nutrition, it may be about skincare. We've talked a lot about vaccinations in the last several months. But those doc talks are really a good way for a senior to get to know a little bit more about their health, to be able to ask any questions they have about their health or about the concern of a particular disease. But the doc talks are really a lot of fun. We really want to see ourselves, like you say, as a community center, as a home for our patients, and not just your typical doctor's office.
Dr. Casey, as we wrap up, is there anything else you would like to share either about the center or yourself as a physician?
Yeah. We're just, like I said, we've been here since July. We're looking to build additional centers, but we have our current 6. I just know that this is the type of care I want my parents to have. I want my parents to have a strong relationship with their doctor. I want my parents' doctors to love them and to treat them like members of the family. And I know we do that here at Dedicated. So we have plenty of room in our offices for additional patients. Feel free to reach out to any of us or stop in one of our centers and check and see. We'll make sure that you can meet the physicians that'll take care of you. We can be found on the web at www.dedicated.care, and that's a good way to get some additional information and come on in. So like I say, we're happy to be here, and we're happy to bring better health to the seniors in Detroit.
Well, thank you so much for taking time out of your morning and joining us, Dr. Casey.
Great. Thank you, Maddie.